Welcome to Your Health is Your Wealth. My name is Arga Duenas and I'm your host for today. I'm also the owner of Back to Nature Health and Wellness Center, located 115 Ridgely Avenue in Annapolis. Back to Nature is a holistic health center that has served the Annapolis, Baltimore, Virginia, D.C., and Delaware area for over 25 years. I know that you would agree with me today that good health is our greatest asset and our most precious gift. Not our money, cars, bank accounts, homes, job titles, or status in life. With that being said today, I have as my very special guest today, Dr. Jeffrey Kucine. He is the founder and CEO of Center of Integrative Medicine and Osteopathy,
Correct.
located in Annapolis, also on Ridgely Avenue. He is here today to share with us vital information that can be life-transforming and life-changing. Also, Dr. Kucine is here today to empower you to take charge of your life and your health. I said a mouthful, but that's okay.
That was great.
I'm so happy to have you here today with me, Doc.
Well, thank you very much.
And the fact that we're right next door to one another,
Great.
that is a blessing. Now, before we talk about your center, tell us something about Dr. Jeffrey Kucine. How did you get to Annapolis? Because I've known you, oh my God, it's been for about at least 20 years. Am I right?
Long time, yeah.
Okay,
yeah.
and you first started on Bay Ridge Avenue.
Correct.
All
yes,
right.
In a tiny little house.
In a
little gingerbread home.
That's right. So what guided you here to Annapolis, and what guided you into integrative medicine?
Well, I think I've been in Annapolis almost 30 years now, and I came here from a practice in Baltimore. And at this point, it's just my wife and I in our home. Our two kids are out of the house. One is a bank manager at the Bank of America. And
Locally,
okay. And the other is running a farm in South America down in Chile.
Wow.
So
Two different worlds.
Two different worlds, but they're both happy, which is great.
Wow.
So, I've always done a bit of a holistic practice, a little bit of integrative medicine. But I for many years, I focused on the osteopathic aspect,
Right.
which really has a lot to do with manipulation of the body. Maybe somewhat similar. Most people are familiar with chiropractic. I think it's maybe a little more gentle. Maybe I shouldn't say that because chiropractic can be very diverse.
Right.
But for me, with the osteopathic manipulation, we look at the body from head to toe, looking for areas of imbalance, trying to use gentle techniques and bringing the body into balance. And we find when the body physically is balanced, then viscerally inside the organs then come into balance, and then we can watch full health really just kind of blossom.
So you're manipulating a connective tissue?
So the approach that I take, we're working with the skeletal structure, connective tissue, the fascia, muscles, and one might even say the energetic system of the body.
Does it hurt?
No, it's very pleasant. Most people are very happy. Well, actually, a lot of people fall asleep during the treatments.
Wow.
The treatments, sometimes we do shorter treatments that last 20 to 30 minutes, and then other times they can be 45 to 60 minutes with a patient. So we're really getting in depth with people.
Well, I have visited your office on Ridgely Avenue. It's absolutely beautiful.
Oh, thank you.
When you walk in there, you really, it puts you at ease.
Yes, and that's what we
it's
want.
not like a clinical type setting.
Yeah.
To a certain degree. The decor is beautiful, the music, you have just a beautiful water fountain there. And when I walked in, I said, oh, wow, this is just, people need to feel at ease because we're so stressed. Every day I get clients who sometimes are so stressed out that I can feel their energy. We're energetic beings, are we not?
Yes, of course.
So we can transfer that energy as well. So you want to make your patients, your clients feel at ease.
Yeah, I feel that's important.
Yes.
Yeah.
So tell me, what services do you offer?
Well, of course, we offer the osteopathic manipulation that we just talked about.
Right.
Then really more of the integrative approach. I truly love the term integrative medicine.
What does that mean, Doc?
So we have what people call holistic medicine, alternative medicine, a lot of different terms. But integrative to me, fits the bill the best because we're truly integrating all different aspects of the healing process for people. I mean, we are spending time with patients, we're listening to their story, kind of witnessing their pain in a non-judgmental way. And
Right.
I think a lot of times for patients, just being heard and connecting is the first step in, truly healing and getting well. And then at times we will write prescriptions. We don't overdo it, but medicines are a wonderful tool to have. Of course, we use the manipulation. We do a little bit of dietary kind of modulation with people. We don't get too carried away with that because it's very hard for people to give up their habits, but we do kind of assess, what they're eating. We primarily, at this point, do a blood test to look for food sensitivities.
Okay.
And that's been huge. We find if we can remove the food sensitivities or allergies
Right.
for a period of 6 weeks as best we can, most people will experience a heightened health, decreased aches and pains, a little more mental clarity, sleeping better.
Right.
And then we'll also teach them, kind of stress reduction techniques.
Okay.
And then importantly, I do use a lot of supplementation as tools to help people get better.
Well, let me ask you a few more questions.
Yeah.
What would a typical visit to your office look like?
So let's say somebody came in, low back pain is such a common complaint out there. So they would come in, fill out a little cursory paperwork, and then we would bring them back into the treatment room. And I would spend anywhere from 15 to 30 or more minutes talking with the patient, taking a history, seeing what maybe perhaps caused the issue that they have. And then we would do a little bit of a physical exam, and then we would determine if they would need osteopathic manipulation,
Okay.
or if they would need any medication or some nutritional manipulation. We also do a lot of injection therapy, which I kind of didn't get into.
Okay, we can talk about
Yeah,
that.
we can talk about that
Before
later.
We
That's
talk
kind
about
of
that. You mentioned in your brochures about multiple pillars.
Oh, yeah, thank you for bringing that up.
Can you talk about that and elaborate on it? a little bit
Yeah,
more?
so we look at what we call several pillars, and the pillars are really different physiologic systems within the body. So some of the most important ones, and when we get those to heal themselves, that's when we see the big change in people. So the first one, it's hard to say which one is most important, but the GI, as you know from your own work,
That's right.
the gut, hugely important to get that moving in the right direction. Not just for digestion of food, but almost 80% of our immune system comes out of the gut.
Absolutely.
The feel-good hormone serotonin a lot
That's-
comes out of the gut. So the gut's a big key.
And I'm also told that the gut is called the second brain.
Yeah, the second brain, yeah. So in ancient Chinese
Yeah.
medicine, they talk about people having two brains, the intellectual brain here and the emotional brain here.
Absolutely.
We all know about having a gut feeling,
Absolutely.
butterflies in the stomach.
Absolutely.
Very important.
So detoxification is also
That's another
That's
important
a
pillar.
pillar,
That's
yes.
not a pillar we get into right away, at least in my approach, because I have found through experience if we create too much of a detox and the person's body is not ready for it,
right.
it can throw them into a bit of a tailspin.
Right.
So detox we might kind of reserve for a little bit further down the road, but very, very important.
Right.
And as an offshoot to enhancing the health of the GI tract, part of detox is supporting the liver.
Right.
And that's amazingly important.
Let's talk about the liver because
Yeah.
I am affiliated with a company that really focuses on detoxification, but also supplementation. And I did a little conference call with one of our clients. And we know that the liver is on the right side, weighs about 4 pounds. It has about, oh my God, 500 other functions other than filtering
Correct.
our blood. It's the only organ in the body that filters the blood. Am I right?
Well, kidneys in a
Kidneys,
sense.
but it filters.
but mostly the liver.
Yes, and it's
Yeah.
connected with all your kidneys, your gallbladder. Am I right?
Correct.
And it also can have an effect on your liver. It helps to make
On your
70% on your
thyroid,
thyroid.
okay.
I'm sorry, your thyroid.
Yeah.
It also helps to make about 70% of the good cholesterol
Correct.
in the body.
Yeah.
Am I right?
Yeah, most
So can
comes.
you elaborate? You were just sharing with me that more and more people are developing non-alcoholic
Correct.
fatty livers. Am I
Right,
right?
right. And if we catch that at an early phase, it's very easy to treat. And it is becoming more and more common out there.
Why do you think that?
I think that, our food supply, the water, the air, I don't want to paint the bleak picture,
No, but it's
but we
true.
just have to be aware of it,
Right.
and then we can approach it in a healthy way.
Right.
So I think our liver has been, amazingly busy over the past few years, 24 hours, 7 days a week,
7 days a week.
consistently, constantly filtering the blood.
Right.
So what I see in my practice is not so much that we have any state of advanced liver disease, of course we have that too, but more commonly what I see is just an overwhelmed liver, an
Right.
overwhelmed system of the detoxification.
Right.
So the liver enzymes or on the blood tests will look okay. There's other signs and symptoms that we can, assess and appraise in the body and see that the liver might be overwhelmed. What's beautiful about the liver is that it's regenerative.
That's right.
And it's not that hard to treat. And as an example, just a little bit ago, we had a patient in his mid-40s. Unfortunately, he came back from the Middle East and being a soldier and got a little too much into the alcohol, and he started developing a severe disease
Right.
of his liver to the point where they wanted to do a liver biopsy, which is not a pleasant experience.
Right.
So I knew he would be okay. I asked him if he would just give me 6 weeks to do a little work on his liver.
Right.
And he was good with that, and we just used a few herbs, a little bit of dietary change, especially removing the excessive alcohol that he was doing.
Right.
Within 6 weeks, his very elevated liver enzymes came right back to normal, and he didn't need any kind of a liver biopsy.
Wow. Well, that's a true blessing.
Another amazing thing about the liver that just amazes me is for years with insomnia, with people that couldn't sleep, we would talk about sleep hygiene, and if it didn't work, we would just prescribe Ambien or Lunesta, different medications to get people to sleep. Well, in Chinese medicine, as you probably know, there's 12 major meridians.
That's
There's
right.
many meridians,
Right.
but there's 12 major ones.
Right.
And in Chinese medicine, they assign a 2-hour time frame to each meridian when it's most active.
Okay.
The liver meridian is most active between approximately 1 and 3 a.m.
In the morning, right?
Yeah, so
Yes.
when I take a history, if a patient tells me they're not sleeping, I always ask, is there a particular time when you're awake?
Right.
More times than not, they'll tell me, yeah, I'm always awake at 1:30 or I'm always awake at 3. So when I hear that and there's other signs or symptoms,
Right.
what I will do is just treat their liver.
Right. Okay.
And as another quick example, we had another patient who, again, in his mid-40s, his main complaint was insomnia,
Okay.
said he couldn't ever remember sleeping through the night, even as a young boy.
Wow.
We put him on just some simple liver enhancement kind of supplementation.
Okay.
And he came back in 2 weeks, and he was elated for the first time
That
that
he
he
could
can
sleep.
remember. He slept through the night.
That is
And
awesome.
he continues to do that. So the liver, we can have a whole
Yeah,
session
yeah,
just talking
listen.
about the liver.
Yeah, but that is awesome because
Yeah.
I remember Dick Gregory said many
Yeah.
years ago
Sure.
that sleep deprivation was going to be a major health problem in youth, and now it is because I have women and men who come in, but mostly women who complain about not being able to sleep. But the major complaint with my practice is that they can't go to the bathroom.
Right.
And so we talk about the colon, the gut being the emotional center, and all of the stresses in life is held right here.
Yeah.
There's a psycho-emotional component to our being.
Absolutely.
And I find that when my clients get colonics, then they go into a good detox diet, eliminating, we call it the bad foods, the gluten,
Yeah.
the junk foods, the processed
Dairy,
foods,
yeah.
the dairy, the foods that doesn't have any life force energy, no God force energy. It's just, I call it dead plastic food.
Yeah.
That it just causes inflammation and constipation.
Exactly.
So now, can we talk about the state of health of America? Doc, recent stats says that the number one cause of death in America is heart disease. The number two cause of death is colon cancer, and that colorectal cancer now is on the rise in young people, and that the third cause of death is medical errors, believe it or not.
Shocking.
We know autism and Alzheimer's is on the rise, and our young people now are beginning to develop age-related diseases, and they're leaving the planet too soon. I'm witnessing this, and I think it's disproportionately higher in the African American community, honestly, because there are more funerals in our community than none. And so I am adamant about raising the health consciousness and empowering people to take charge of their life and their health. Right now, we're in springtime. What are some things that we can do on a daily basis to cleanse and detoxify the body, or get the body back into balance?
That's a great
Drinking
question.
water. You mentioned this right here.
Yeah.
Let's talk about plastics, number one.
Well, so let me back up just for a minute. I mean, drinking fresh water is key, and we have a little device that we use with people to let us know if they're dehydrated or not, or if they're drinking enough water. And it's amazing how many people are dehydrated.
Yes.
And just getting them to hydrate,
That's right.
drinking water, not soda, not iced tea,
That's
not beer, not whiskey.
There's a book I used to read many years ago called The Body Many Cries for Water.
Yeah.
Have you ever heard that book?
I have not, but I'm not surprised to hear it.
A major problem.
Yeah.
People go into the hospital because of dehydration and don't know
Absolutely.
what's wrong.
I mean, I had a patient years ago, severe migraines, had seen all, the specialists up in Baltimore, at Hopkins, et cetera, and she wasn't really responding. And in taking a deeper history, it turns out the poor kid, she was only 16, would never drink anything. And we just got her to drink a couple of liters of water a day, which sounds like a lot, but it's really not that much once you get used to it. And her migraines are gone.
So
just
how
from hydrating.
How much water and what kind of water? Because you hear people talk about alkaline water. And
yeah, so the body truly enjoys being in an alkaline state. And in fact, the bioterrain, what I would call, that's one of the pillars that we address. And so we test people's pH, which determines if they're more acidic or alkaline. And the acidity in the stomach is very strong. I mean, if you put your finger in there, within 20 minutes, it's gone.
Yes.
So, but the rest of the body really prefers to be in an alkaline state. I find even with anxiety with people, when people get anxious, they become shallow breathers. We get rid of now we know we get rid of a lot of waste through our guts.
That's right.
But the breath literally gets rid of almost 70% of our waste.
Really?
Yeah, and so fecal and urine is about 25%, and skin's another 5%. But when people breathe shallow, the whole system becomes acidic. Not only do the muscles not like that, but the brain itself doesn't like that, and it creates anxiety. That's why typically when people are anxious, we try to calm them by saying, take some deep breaths.
Absolutely.
The deep breathing will begin to alkalinize.
Wow, so that is very important, the breath.
Yeah, so water, if we can find water that's more on the alkaline range, I think it does make a difference. And in fact, at our home, we started getting a few years ago water that comes from a spring in Arkansas. Supposedly the same water they drink in the White House. I don't know if that's true or not. But anyway, it's water that's more on the alkaline side.
So what's the pH of the water then?
I think it's around 8.
8, okay. Because at some stores now they're offering alkaline water that's 9.0. And do you think sometimes it could be too high?
I think
because that stomach acids have to be strong enough to digest food. How does the alkaline water, if it's too high, does it dilute the acid in the stomach?
Well, that's a great question, because while we eat, it is important to drink, but it's important to just drink a little, maybe a little bit before, a little bit after, so as not to dilute, the digestive juices. But I think in a healthy person, which there's a lot of unhealthy people walking around out there. So I believe drinking more highly alkaline water can actually benefit them.
So what are some other things that we can do, especially for our liver? You hear people talking about dandelion, eating dandelion greens, dandelion herbs, coffee enemas. What are your thoughts?
Sure, the coffee enemas are great. That's more your purview. We leave that up to you. We send the patients to you for that. But the beet leaf, the greens, all the cruciferous vegetables are so good for us, and those are broccoli, Brussels sprouts, cauliflower,
Also cancer
collards,
fighters,
things
right?
like that.
Yeah.
Yeah, big cancer fighters,
Mhm,
yeah.
mhm.
And I think, getting out there now that the air is nice, getting out and getting some exercise
What
is
about
key.
vitamin D? Because we hear so many people
Yeah.
have issues with vitamin D deficiency. And talk about vitamin D for us.
Well, that is a huge problem. I mean, I would say almost 80% of the people whose vitamin D levels we check are low.
Okay.
And I think maybe it could be because we've become afraid of the sun, which we need to be concerned about it so that we don't get a consistent sunburn.
Right.
But the sun, in a sense, is our friend. We need exposure to it. The average person, it takes about 30 minutes of full body exposure to the sun to get the daily dose of vitamin D, which once the sunlight hits our skin then converts other things into vitamin D. But most people are covering up everything.
Right.
Even the face creams they put on
Now, what
have
about
sun
that? 'Cause
protection.
you see a lot of information about this that it blocks.
Yeah.
The suntan lotions block the vitamin D.
I think we've overdone it.
What are some conditions or deficiencies that are linked to vitamin D deficiency? Because you hear people, some doctors say that cancer and inflammatory diseases are linked,
They can be.
indirectly to a vitamin D deficiency.
So vitamin D is there's some talk of reclassifying it not as a vitamin but as a hormone.
Right.
Right. So,
Right.
all my patients, we try, like the healthy range on the blood test for vitamin D, I believe, is around 30 to 100.
Right.
So a lot of doctors, if they see that their patient's level is 32, they'll say, oh, you're fine, you don't need any vitamin D.
Right.
But I think more and more we're starting to see that if we can bring the vitamin D closer to around 60, there is some evidence that can be protective against particularly breast cancer.
Okay.
So almost all my patients, we try to bring them up to a level of 60.
Okay.
There's also a fascinating thing that we just started doing this year with vitamin D to boost immune function.
Okay.
With the cold and flu season. We were really able to knock out the cold and flu
Wow.
with a lot of people very quickly with very high doses of vitamin D.
Oh, wow.
Yeah.
So when you say high dosages,
Well,
what do you mean?
I don't know if I should say online because it's a little
because
different with each person.
Okay, yeah.
But we do.
But would you agree that everybody should get, because many people don't they don't ask their doctor, or their doctor won't test them for
Right.
vitamin D.
More and more doctors are, but
They
you're
begin-
right. They should ask, and I think that's the beauty of today's world too. We were talking earlier how people now are becoming more self-empowered.
Right, absolutely.
Where it's no longer the doctor's the general and the
Right.
patient's the
Right.
private just doing what the doctor says.
So we're working
As a team.
which
together.
together.
I think makes a big difference.
Well, what do you think about other supplementations like minerals and vitamins? We know that all minerals and vitamins are not created equal, because I
Correct.
can say that I've spent over the years thousands of
Correct.
dollars.
Me too.
But you got to be real mindful and read the labels. Am I right?
Well,
Would you go into
yeah,
that?
that's another beautiful question because me too. I've been taking supplements since I was a kid. And at least once every couple of weeks, I'll have a patient that will bring me an article from the New York Times or Time Magazine saying, don't waste your money on supplements because they don't do a thing.
Right.
And I have to tell them that, they're correct, that these, you have to be discriminatory as to which supplements you're going to purchase and take.
Right.
There was, I used to buy my supplements at Sam's Club because they were so inexpensive.
Right.
But there was recently, well, it was a couple years ago now, a fish oil that was tainted with naphthalene, which is what they make mothballs from.
Wow.
Now, fish are tainted with heavy metals, but no fish is eating mothballs. So it turns out, when they investigated, they found that this particular fish oil was being made in a factory in China that was also making mothballs.
Wow.
So they were totally intermingled. So vitamins and supplementation is really one of the things that you truly do get what you pay for. So we do carry supplements in the office. These are all supplements that I've investigated, where I've actually gone to the manufacturing plant. One company in particular, they've been around since 1929. They have their own, I think it's a 1,200-acre organic farm.
So it's food-based.
Food-based, whole food-based.
That's right.
And here's the farm and here's a manufacturing plant. And, visiting the farm, I mean, the color of the soil, And this organic farm, I don't know if they can see the black curtain, but it's the soil is literally black.
It's rich.
It's rich. It's
With
people
minerals.
almost want to reach down and touch it.
Wow.
Whereas a regular farm is more kind of a light brown color. It's devoid of minerals.
Right.
So it does become important, which companies people are choosing to take the supplements from. There's a potency that is not there in all companies.
So let's talk now about inflammation and what causes inflammation, because I think that is the root cause of disease.
I would totally agree. Inflammation and infection. And I'm not sure which, probably infection comes first.
Okay, well, you can elaborate.
But inflammation, I think a huge problem with people is the diet, is the foods that we're eating. People are eating foods out of a box, out of a can. Even, I think sadly, even buying organic foods in the supermarket, if you look at the label, I love South America, but it's a beautiful place.
Right.
But to get our vegetables from thousands of miles away that are picked before they're ripe, so they're not even getting their full, nutrient value from the soil, being handled, bounced, and by the time we pull it out of our refrigerator, we are going to get a little bit of the fiber and some of the carbohydrates and things like that. But as far as the phytonutrients go, they're just not going to be there. And that's why it's important to take supplements.
To supplement. I want to thank you for saying that, because so many people, even my doctor, she says, no, you don't need to take supplements.
I think 100 years ago that was true. In
it's
today's world, it's just very different.
So would you agree or encourage the viewers to support local farmers and try to
Absolutely.
get
That's, in fact, I have a couple patients that are growing organic foods in their own, little, not really a farm, but a little extra space they've created at their home. And for a minimal fee, they will deliver organic food to the door.
They have these co-ops, right?
It's like a co-op. So that's what we're doing. It hasn't started yet.
Awesome.
Not through the practice, but my wife and I through a patient of mine.
Well, there is a farm, or organic farm in, I think, Shadyside, called Red Top. I just happened to be driving down the road, southern part of the county, and there's this lady that she grows just the amazing organic kale, collard
that's beautiful.
greens.
That's great.
It's called Red Top.
I'm going to write that down later.
Write that down. I'm supporting her. She's local. They have their own chickens. They have eggs, everything down there.
Love the fresh eggs.
Fresh eggs, everything. So now, one more question, because we got to go in a few minutes. So what about butter and eggs? We were told not to eat butter and eggs.
Well, I'm not sure where that controversy started, because
the cholesterol myth.
It is a myth.
Yes.
Because butter and eggs are great foods. So I see no problem with that.
As long as it's organic.
The organic is the best. The eggs are a beautiful form of protein. Also gives the body a lot of sulfur, which is very important as well. And the butter is fine. I mean, margarine is just really not a good food.
They say it's one polymer away from plastic.
Pretty much.
Dr. Kucine, I am so grateful and honored to have you as my guest today. And I thank you for taking time out from your busy schedule. And I'm going to invite you to come back again.
Yeah, I would be happy to come back and talk more.
Please give our viewers your address over there in West Annapolis and your phone number.
Sure. So we're in West Annapolis at 107 Ridgely Avenue, 14C. The phone number is 410-263-3313. Feel free to give us a call. We'd love to see you.
Thank you for watching. Your health is your wealth. And remember, in this very present moment, we do have the power to take charge of our life and our health. Have a great day. Thank you so much.
Thank you,
That was
Artie.
awesome. Thank you.
Sure.